Hello, I'm Dr. Saloni. I'm currently third year postgraduate in Department of Ophthalmology. Today we'll be discussing about ophthalmology in AGMC.
So, welcome Saloni. So we'll talk more about your department of ophthalmology. So first tell me about how's the setup in your department. How are the professors and assistant professors, the number of PGs and all the quotas, everything?
Currently we are 3 PGs per year. The seats are 3. Out of this, one is from All India, one is from state quota, and the other seat keeps on revolving between either of the two. The faculty, we currently have 6 faculty, 1 HOD, 1 associate professor, 3 assistant professors, 1 SR, and the 3 PGs that are there. This is a small department. Yeah.
So you are final year PG.
Yes.
So how has been your journey so far? If you want to describe in few words.
Commendable, like a great journey, a great department, and a great place. Like that's how I can summarize the whole journey. Full of like learning and new experience altogether in a field of ophthalmology. Hazelnut cappuccino. Normal.
So I would like to know more about your work routine.
The day as an ophthalmology trainee starts at around like 7 a.m. We have to be in the department at like sharp 7 a.m. Pre-op and post-op. We have 2 units in ophthalmology, and so the work starts. Either you are pre-op planning the patients, like prepping of the patients, or you are post-op giving the rounds with the consultants. Followed by the OPD or OT, which like starts at around 9 a.m. And it goes on depending on the patient load till 4:30 to 5 p.m. And after that, it is followed by if it is the admission day of that unit, it is followed by the call routines, whatever is the call roster that is made according to that. Yeah.
So how many patients you see on average on daily basis in OPD, and how many the hands-on?
Yeah.
कितना केसेस करने को मिलता है?
Let's divide it into 2. If you are in OPD, OPD also depends on the units. Like the unit 1 has around, you can say per day 400 patients, in which you get a good hands-on on the patients. Get to see the patient on the first hand, then you get to ask the complaints, send for the investigations, and then make a provisional diagnosis, show it to your consultant, show it to your senior, give a proper like plan that I think the diagnosis is can we start the patient on this, and like slit lamps are there, examine the patient. It's a good hands-on on the OPD. And if you are talking about the minimum patient average in OPD will be around 200, take it like this. And OT also again depends on the units, and in like first year or any year per se, minimum you'll get 150 to 200 cases of OT. It's like minimum that you're getting currently. That's the scenario. Yeah.
So how many number of days you get as holiday, leaves and everything? And are you
No leaves.
No leaves?
No leaves because one day is your ad day, other day is your OT day, ad day, OT day. Sunday maybe your ad day. If it is not an OT, it's a free day.
Okay. So how's your department as a whole, if you want to say, on a personal level, and in case in terms of academics, how it is like, how much opportunity you would get to go out to attend conferences, because we know it's a peripheral government medical college and it's not that easy to PGs to go out, and what we have seen in the culture usually. But what about your, I'm curious about your ophthalmology department.
Yeah. So we'll again take it like the work culture per se. There is no there's a good work culture, there's a good reputation, there's a good rapport among each other as well. There will be no toxicity. The most important is nowadays there is no toxicity coming from the consultant side.
Cheers. So tell me, Saloni, from where did you do your UG?
I did my undergraduation from Guru Gobind Singh Medical College, Faridkot. It's in Punjab.
Okay. So Saloni, can you tell me your personal reasons why you took up ophthalmology?
Number 1, I say the branch. I always think it's not you who choose the branch, it's sometimes the destiny and the branch that chooses you. So ophthalmology is what I say, a blessed branch. It gives you a gist of the medical field as well as the surgical field. One day you're seeing patients, you are working as a medicine personnel or as a pediatric personnel. Again, you get kids also, you get the geriatric thing also, you get the middle-aged persons also. It's summary of all the fields in general. And then the other day you are in the OT working as a surgeon. The adrenaline rush of the surgeon you get every time when you are operating a case. And we say every eye is different. Every eye feels different. Every eye behaves differently when you are operating. It's a microsurgical field. Takes long years to master just like a one surgery. The learning curve is a bit longer than the general surgeons, but it's a very rewarding branch. It's a very rewarding branch. It's a very peaceful branch. It's a very neat and clean branch. The pro is you are sitting and doing the OT. So if someone has history of syncope like me, you are in the safest field. You sit at your comfort, do the OT. It takes hardly 15 to 20 minutes if you're a postgraduate, and if you're in your 35s, if you're trained, it takes hardly 3 minutes to a cataract surgery. So it's like a brilliant branch. It has the gist of both. So that was the reason I took ophthalmology, plus the luxury and the comfort that is attached with it. I am not a person getting a call at 12 a.m. in the night that there's a delivery or there's a perforated abdomen. So there are very few emergencies in ophthalmology, very few. Needs to be catered again, but yeah, it gives you the life that post your work time you can enjoy your life without getting calls from the hospital.
So Saloni, तुसी तो पंजाब से हो. So I was curious as a Punjabi, how is your experience in Tripura?
Tripura is a small Bengal, I would say, but with beautiful people, beautiful soul. And I mean it, like honestly. When I was coming from Punjab, I was skeptical. लोग कैसे होंगे, खाना कैसा होगा, culture, language. I am like standing here and vouching. It takes hardly 2 months to learn Bengali. It depends on how curious you are. But learning is important also. It helps you to better counsel patients, talk with them, communicate with them. Food, predominantly Bengali food, non-veg food. A bit difficult if you are veg, but alternatives are very easy. Plus you can cook any day, but tiffin services are there, so not a big deal. The atmosphere, the weather is really good in comparison to North India, especially because where the winters are very harsh, the summers are very harsh. It's moderate temperature here. Mostly it's the same temperature, the 12 months.
We had a very nice conversation in the very first episode of Affogato with Ananya with Dr Saloni Goyal. She has given inputs about her branch, ophthalmology. So I hope this video was helpful, and make sure you like, share, subscribe. Because I had a runny nose, मौसम बदल रहा है. So instead of Affogato, we started the episode with not with Affogato but with hot coffee. So in future episodes, I will be, I think, not having Affogatos, but that's not the main thing. The main thing is that you got information about ophthalmology as a branch in Agartala Government Medical College. Make sure to hit like if you could relate and you got the appropriate information. Make sure to subscribe if you want to know more about the other branches, which I'll be uploading further. Thank you again. Happy festive season.